Hello, my name is ANNDELORIS CHACUN. I am the CEO for Bristol Black Carers and the past clinical coordinator for 11 years for sickle cell and thalassemia patients. My experience in the NHS with the patients with sickle cell has been joyful and been a bit frustrating at times because they are not understood, and it is because their pain is not recognized because it's not something that could be physically seen. Patients are queried about when their pain starts, how the pain is going, and it leaves you to wonder, why do we say that the pain is according to what the patient says, but yet still we as professionals tend to disbelieve? As a professional advising the carers and the caregivers and the sickle cell patient, it is important to understand that we need to listen to the patient first, because the pain is in any part of their body and we don't need to doubt, we just need to support. And for those of us who don't know about sickle cell, it is a genetic disorder in the makeup of their red blood cells, and the circulation is in every part of their body so that they can have a crisis in a minute part or their entire body. So people first have to understand that. Then to be in constant pain frequently has a psychological effect which we do not recognize. And the fear of death is another aspect that the sickle cell patient lives with, because they don't know when they enter hospital will they be going back home.
So let's fast forward now to you here at Bristol Black Carers. How do you support your sickle cell service users now at Bristol Black Carers?
Well, because I have left over more than 7 years now, and unfortunately the post of clinical coordinator, which was attached to the community to support the sickle cell patients at home and link them to the hospital, has not been filled, there is a gap. And the understanding of what happens at home and what happens in the hospital and relaying and connecting the two has not been happening for them. And right now they have reported to me that things in the hospital seem to have gone backwards because nobody's listening again. So they need an advocate, and in this capacity we support the carers to start with to help them understand the process, and then we support the patient themselves, because the family as a whole needs to understand what is happening, what is being used, how it's being managed, in order for the patient to get the best out of their care. That is why when we are campaigning, we asking our communities to come out and give blood, because if our service users, patients receive blood over a number of times and it doesn't match exactly, they develop antibodies. And when they develop antibodies, it reduces their ability to get more blood. And because the blood is there to change and improve their life, they will not be able to have access to as much blood as possible to keep them going. So we need from our communities to give life. Blood is life, and look at it as a gift and not as a burden or as something that is hassling us. Because when you give blood, your body regenerates it. So it's even making you healthier in some instances, because you've given yourself a new lease to create new blood cells. And your blood cells do die after 120 days. So why not take it out, give it to someone to use, and make more in yourself? So that is what I would like to say, that we can be giving life to another person by giving blood.